I'm Madeline Stein, and my project is on obesity. Symptoms of obesity include excessive weight gain. One may also figure he has obesity if there is a presence of large amounts of fatty tissue. Some secondary symptoms include shortness of breath and pain in the lower back, which is caused from carrying the excessive weight. This disease is caused when a person consumes more calories than the body burns, and the excess calories stored in the body is fat. Eating habits and the amount of physical activity one gets also contribute to obesity. Mental health, along with hormonal and genetic disorders, can also help cause it. Sometimes babies are just born obese. Both sexes are susceptible to obesity, along with all ethnic groups, age groups, and social groups in the United States and around the world. In adults, more women are affected by it than men are. It is also very common in teens and children and is the most common nutritional disorder in the United States for them. In the United States, more African American and Hispanic children are affected by it than Caucasian American children. Genetic factors can contribute to obesity. They can come from either or both parents. Genetics influence the rate of one's metabolism, which is the rate that the body turns food into energy. However, one's genes do not necessarily mean they will be obese. Genetic factors themselves do not cause obesity, but they can contribute. Obesity is linked to nutrition by overeating and the type of food that is consumed. It is also caused through one's secondary lifestyle, meaning their environment, their social life, and their culture. Secondary lifestyle also includes exercise and is more common in people who don't work out. It is linked to nutrition by the treatment, which is eating better, by the cause, which is eating poorly, and prevention, which is eating right. Specifically, the eating habits of many today have changed. For example, people consume larger and high-calorie meals. Public places offer a poor selection of nutritional food, offering processed junk. These foods are eaten by the population and contain a high amount of fat, which impacts weight. People should instead be balancing carbohydrates, fruit, vegetables, and protein. These foods are converted into fuel right after they are consumed, while fats are stored in the body's fat cells that multiply and expand, adding to the body's size and weight. Someone living with obesity should include a large amount of fiber in their diet and less carbohydrates and fat. Fiber will help eliminate the fat content. They should avoid refined carbohydrates or sugar and foods that contain excess sugar. This includes sucrose, glucose, high fructose corn syrup, honey, and brown sugar. They should also avoid refined grain products like white rice and white flour, which can be substituted for whole grains. Fried food too should be eliminated. Obesity does not kill an individual, but does increase the chance of health problems like high blood pressure, type 2 diabetes, cancers, heart disease, strokes, asthma, back pain, liver disease, high cholesterol, kidney disease, sleep apnea, and more. Those who are extremely obese have been found to live 3 to 12 years shorter than those who have normal weight. Obesity can be cured with dedication. For those who are mildly to moderately obese, behavioral changes can be made. Weight loss programs like Weight Watchers have been proven to be very effective. A doctor may suggest or prescribe appetite suppressants. In severe obesity, sometimes more than dietary changes and modifications may need to occur. One might need surgery to bypass portions of the stomach and small intestine. People with obesity must make adjustments to their everyday lifestyle. Toilets with a higher weight capacity may need to be installed. Body washers may also need to be used. Dressing aids may need to be purchased and bars might need to be installed. One might also need to buy support belt. 3 famous celebrities include Melissa McCarthy, Nikki Blonsky, and John Candy.